Mary-Louise McLaws is an advisor to WHO and the professor of epidemiology of the University of New South Wales. She joins me now from Sydney. Hello there, Mary-Louise. It's good to have you with us on the show. Now, if approved, what would the waiver mean?
Well, it will mean many things. First of all, it will mean that countries can potentially set up manufacturing of, say, a vaccine that is cheap to manufacture and has a good vaccine efficacy, and rather than waiting to have to buy their own at a higher price. At the moment, there's only 2 countries that have got anywhere near 20 persons or per 100 that have received at least 1 dose, and that's the EU and the USA. And all the other top populated countries have very, very little vaccination at the moment. So this would go a long way to reducing the cost for them and increasing the speed at which we could get global coverage.
And how would the waiver on vaccine property boost the supply? This would mean a lot for the countries like India or South Africa who are still struggling to get enough supplies.
Exactly. So with vaccines that are made by weakening or inactivating the virus, and there are several of them, or viral vectors, they're much easier to make than, say, messenger RNA viruses. And therefore, people can set up very rapidly, like India and other countries, facilities and their scientists to help develop that vaccine and also improve on it. And I'll just remind you that back in the 50s, Joseph Salk, who invented the polio vaccine, did not have a patent on it, which meant that it could be improved dramatically. It then became an oral vaccine, and it became the Sabin vaccine, and it was safer and easier to administer without an injection. So this is the sort of thing that could happen. There's one downside, though, and that downside is that all of the innovation that pharmaceutical companies put in and the money that they put in to develop vaccines, particularly, say, the messenger RNA ones, which are quite remarkable, they need to be compensated. There needs to be a system where we don't have scientists and a large company saying, we're not going for blue sky research. But when we have a pandemic, that's when they need to start thinking about the greater good and not this monopolizing of their product for making money.
Right, but I mean, as I just read that tweet there from the WHO head, he's calling this decision a historic. But what kind of reaction can we expect from the pharmaceutical companies moving forward?
I'd say a lot of pushback, and it is an historic idea that big, capitalist country like America would think that this was a great idea, and it is a great idea, but there'll be a lot of pushback, and so a lot of other countries have to get behind the Biden-Harris administration and also agree that it's now time. I've estimated that even if the globe were to be able to inject at 11 million doses per day, and that was based on February's, about week 8 or 9, where countries were doing well, that would take us 3 years. So to remove the patent, allow countries to manufacture and to allow them to deliver it would potentially cut down that duration of trying to get herd immunity across the world.
Mary-Louise McLaws, thanks so much. I appreciate that insight for us. She's an advisor to WHO.